I'm Christian Marr from the Crawford Heritage Community Foundation. I'm joined by Dr. John Nesbitt, who's medical director at the Meadville Area Free Clinic. The Free Clinic has been a recipient of grants from the Community Foundation over the years, at least 4 that I'm aware of, most of them to pay for prescription drugs for patients who otherwise could not afford them. John, can you tell us a little bit more about the Free Clinic?
The origin of the Free Clinic is interesting. Back in the early 20th century, medical care in the United States and everywhere was rather rudimentary and not very expensive. People paid out of pocket for it.
Or brought a chicken into their doctor.
That's right. World War II came along, and workers were in short supply. Everybody was off fighting, and the employers, in order to try to attract employees with wages having been fixed, offered health care and health care insurance. And as a result of that, employer-sponsored health insurance became the backbone of the American system. Then things got more and more expensive, and in 1965, of course, Medicare came along and Medicaid, so that took care of the senior citizens and took care of a lot of the poor people and the children. Medicaid took care of the children and poor people. So who got left out? The people who got left out were the people who were working but had low-paying jobs, could not afford the insurance, and they just were they were really struggling. They tended to use emergency rooms, which is quite expensive, and they usually couldn't pay for it. So the hospitals had to pass that cost on to the people who did have insurance. In 1997, Dr. David Kirkpatrick, along with Dwayne Kohler from the hospital, got together and initiated the Meadville Area Free Clinic. There are many such clinics in the country, and it's filled a real need for the people I just mentioned.
Cool. What motivated you to get involved with the clinic?
Dr. Kirkpatrick. I was in a partnership with him, and he was senior to me by quite a few years, and he basically recruited me.
And I know he's a hard man to say no to.
Can't do it.
What type of services do you offer to the people who come into the Free Clinic?
Well, we offer, first of all, intermittent exams and it's usually a lot of it's blood pressure problems, diabetes, cardiac problems. So we offer intermittent examinations by the physician or physician's assistant. And we are able to offer generic medications. And there are a lot of excellent generic medications on the market now. They're very inexpensive. And we can get laboratory tests and x-rays done through the hospital. The hospital stands up and takes the cost of that because we're keeping these folks out of the emergency room. So those are the basic services we offer.
What kinds of things can people do in the community to help support your mission? I know that you have a need for doctors, but beyond that.
Yeah, I have to recruit physicians to try to fill in slots, or I'll do it myself. So that, I guess, of all the people we see now, I probably see about a third of them. We have 6 different physicians, including 1 physician's assistant. But these people have active practices, and I'm mostly retired now. So I can fill in there, but that's a big need. We have, I think we're pretty well covered with volunteer nurses and volunteer telephone people. The biggest thing we need is somebody to help fill in our budgetary needs.
Sure. Money is always a help.
Sure.
And so people can send donations and things to the Free Clinic.
We get a lot of private donations. The service clubs have helped out. The foundation has helped out. United Way is a heavy contributor. I think we got $14,000 from them. Our
Right.
total budget is around $44,000. But the community's been very good about that. But and then when the chips are really down, the hospital does step up and back us up.
What do you think the effect would be on the community if the Free Clinic ceased to operate, if it wasn't here for people?
Well, we'd be back to the problem with the working poor having to go to the emergency room for usually urgent things. They're not going to go and get the blood pressure checked, and so the blood pressure and perhaps the diabetes just won't be treated.
Now, are there other medical specialties or things that you need help with at the clinic?
Yes, we do. We have to refer a lot of people to orthopedics, dermatology, ENT, you name it. And our local specialists have been very good about helping us out.
Great.
They will see them, and dental is also big.
Yeah, I think we'd spoken about that yesterday, that you have a dentist who does some work at the clinic
Right.
as well.
Well, he doesn't do the work at the clinic.
Okay.
Dr. Len Beretta has been very good about accepting our referrals, but he works out of his own office.
Okay.
But most of the dental work is extractions and dentures.
Yeah, but a very community-minded gentleman as well. So
Right.
we thank him for all
Big
that
help.
he's done. And is there other things that the foundation has done that might be helpful to the future of the free clinic?
I think the monetary support is the major thing.
Mm-hmm.
The only other thing that keeps me kind of busy is trying to find enough doctors to fill the slots we have.
Right.
The clinic is open 20 hours a week, and 14 of those hours we're seeing patients. The first year it was in existence, there were 800 some patients, and last year, in 2010, we saw over 1,100. It ticked up when the recession hit.
Sure, as you would probably expect.
But the financial help is really the major thing, I think, and then I have to try to fill in the gaps with the recruiting the doctors.
Great. Well, John, thank you so much for your time. Thank you for the work that you do, and we appreciate it. And we hope to see great things from the clinic in the future.
I've been very glad to meet with you, and I appreciate everything the foundation's done.